Hello, I am Dale Eastman, a 28-year breast cancer survivor and a 2-year thriver of metastatic breast cancer. I serve as Outreach Chair for the Alamo Breast Cancer Foundation. Every year in October, the Alamo Breast Cancer Foundation partners with University Health System's Healthy You mobile mammography van to provide a breast cancer screening and awareness program. ABCF has been facilitating this outreach program for over 20 years. We hold this event to provide screening mammograms to uninsured, low-income women, as well as provide breast cancer information and women's health resources. Because of COVID-19, instead of holding a live program, we have produced a breast cancer awareness and resource film titled Healthy Women Make Healthy Communities.
Hello, I am Charlotte Davis, a 6-year cancer survivor. I am also the president and CEO of Black Nurses Rock San Antonio chapter. I also serve on the board of directors of the Alamo Breast Cancer Foundation. According to the CDC, breast cancer continues to be the most diagnosed cancer and the second leading cause of cancer death among women in the United States. The mortality rate is approximately 40% higher in Black women when compared to white women. Despite improvement in treatment and early detection does save lives. I know because it saved mine. So to end breast cancer through knowledge, education, and community programs, Black Nurses Rock San Antonio is proud to partner with the Alamo Breast Cancer Foundation in the film titled Healthy Women Make Healthy Communities. The film features a presentation from the Honorable Constable Catherine Brown of Precinct 4. She will share her stories of survivorship as a breast and cervical cancer survivor. Dr. Marcella Canola will provide breast cancer information, and retired nurse Rosemary Greenbow will also offer information on breast and cervical cancer information here in San Antonio. Also included in the film, a presentation on healthy Texas women and CareLink. Finally, we welcome remarks from my Texas State Senator Jose Menendez and U.S. Congressman Joaquin Castro. They will provide updates on legislations that will impact the women and their families. I would like to thank the Alamo Breast Cancer Foundation for providing the funds to work for 30 mammograms for low-income and uninsured women. A big shout out to University Healthcare for providing the mobile mammography van. And also Antioch Baptist Church for providing the venue. I also want to thank Black Nurses Rock San Antonio members and board of directors for their support, and Valo Mayo social media and digital marketing for the filming of Healthy Women Make Healthy Communities. A link to Healthy Women Make Healthy Communities can be found on www.alamobreastcancer.org.
Dr. Marcella Mazo Canola is a physician specialist in hematology oncology. Dr. Mazo obtained her medical degree from CES University in Medellin, Colombia in 2007. She then attended the University of Texas Health Science Center in San Antonio, where she completed a year of research, followed by an internship and a residency in internal medicine and fellowship in hematology oncology. Dr. Mazo has a great interest in solid tumors in the Hispanic population, as well as the different health disparities that affect the San Antonio community.
Hello, my name is Marcela Mazo and I'm a hematologist oncologist. So there are some factors that are going to increase a woman's lifetime risk of breast cancer. It's important to know that about 1 in 8 women in the US will suffer from cancer in their lifetime. So the age matters. The older you are, your risk is going to be higher. Other risk factors include obesity, drinking alcohol, smoking is also an important risk factor. And also you have to take into account your family history. For example, if your mother or your sister, a first-degree relative, they suffer from breast cancer at some point in their life, your risk is going to be high. There are some other risks that we take into account. For example, patients that have genetic mutations, those are also going to have a very high risk in their lifetime. ¿Cuáles son los factores de riesgo que pueden aumentar el riesgo de cáncer en una mujer? Hay que tener en cuenta que en Estados Unidos, 1 de cada 8 mujeres va a sufrir de cáncer de pecho en su vida. ¿Cuáles son los factores de riesgo más frecuentes? La edad, entre más años tenga la persona, mayor es su riesgo. Obesidad es otro factor de riesgo. Consumo de alcohol y cigarrillo es otro factor de riesgo. Y también se habla de tener algún familiar en primer grado, la mamá, la hija, que haya tenido historia de cáncer. Y en algunos casos también hablamos de unos síndromes genéticos en los cuales ciertas mutaciones pueden aumentar el riesgo a lo largo de la vida. So early detection is very important because it's going to affect your prognosis. For example, if a patient is diagnosed with breast cancer, when the tumor is very small, the chances of the patient of being cured for the disease are much higher than, for example, those patients that are going to have big lumps or, for example, spread to the lymph nodes in their armpit or spread elsewhere. So the earlier, the better. ¿Por qué es importante detectar el cáncer temprano? El pronóstico va a estar afectado por qué tan temprano esté el cáncer cuando se detecte. Por ejemplo, aquellas mujeres que tienen metástasis en los ganglios axilares o metástasis en alguna parte de su cuerpo, su pronóstico va a ser peor. Me refiero a que el riesgo de morir por el cáncer va a ser mayor. Entonces, entre más temprano sea el cáncer diagnosticado, mejor va a ser el pronóstico. First of all, I want to say that if you feel a lump, that's not normal. You need to go and see your physician. Things that you should check and keep in mind, look at the symmetry of your breast. If you feel a solid nodule, you should get that checked. If you see changes in your skin, you need to get a check. If you notice any abnormal discharge or nipple inversion that is new, you need to get that checked because those could be signs of breast cancer. Bueno, ¿qué pasa si encuentra alguna bolita en su pecho? Lo primero que hay que decir es, si usted siente una bolita, debe consultar a su doctor. So, what are the symptoms of breast cancer that you can see? You can feel a lump in your breast. You can feel a lump in your armpit. You can see changes in the way your skin looks. It looks like it's inflamed. You can see nipple inversion that is new. You can also see nipple discharge. If you see any of these symptoms, you need to see your doctor. ¿Cuáles son los síntomas de cáncer de pecho? Encontrar una bolita en el pecho que sea sólida, que sea dura. Encontrar alguna bolita en la parte axilar. Cambios en la piel que parezcan inflamación del pecho. Inversión en el pezón que sea nueva, que no la haya tenido antes. O algún tipo de descarga del pezón. Hay que ser evaluado por el doctor porque estos pueden ser síntomas de cáncer de seno. So who should get a mammogram? So technically speaking, every woman over the age of 40 years old up to 75 years old needs to get a screening mammography. In some situations, your doctor might recommend that you do an enhanced form of screening with technologies like MRI, but that risk is to be determined by your doctor. Generally speaking, after age 75, we do screening mammography if we think that the patient is going to have a life expectancy more than 10 years. ¿Quién necesita un mamograma? En teoría, toda mujer mayor de 40 años hasta los 75 años debe ser evaluada con mamograma. En algunos casos, esa frecuencia puede variar o se pueden considerar otras técnicas para hacer el tamizaje, como lo son la resonancia magnética, pero esto es en casos especiales. Para saber qué tipo de test es mejor para usted, consulte a su doctor.
Hello, I'm Rosemary Grayboe. I'm a registered nurse with the Alamo Breast Cancer Foundation. I'm here to speak with you about annual screenings. It's important that you go to your medical professional, whether it be a physician, a PA, or a nurse practitioner. It's important to have your annual screenings for diabetes, for high blood pressure, for cholesterol, and also to have a clinical breast exam. The clinical breast exam will determine what type of mammogram you will get. It is a communication to the radiologist. If the physician orders a screening mammograms, it is because there was no lumps on your breast or they didn't suspect anything suspicious, and it's 2 views. If the clinician feels something suspicious on your breast, then it is a diagnostic mammogram along with a sonogram. The reason for the diagnostic mammogram is that it is communicating to the radiologist that there's something there that is suspicious, and there will be doing more than 2 views, looking for whatever it is that the clinician felt. The sonogram will determine if that suspicious mass is a cyst, which is liquid, or if it's solid. Once you are given a mammogram, we encourage you not to get scared and do not let fear enter you. Just because there is a suspicious mass on the clinical breast exam doesn't mean that it is cancer. It could be a fibroadenoma, or it could be a cyst. The same thing, if they do a screening mammogram and you need additional studies, there are some things that a clinician cannot feel. For example, microcalcifications. Microcalcifications, once they start clustering, it could be the beginning of a new cancer. And only a mammogram can pick up microcalcifications. A clinician cannot feel those at the beginning. And we encourage you to do the annual screening mammograms and the annual clinical breast exams, as we believe early detection leads to early intervention, which leads to better outcomes. Hola, yo soy Rosa Maria Grayboe, enfermera registrada con la organización Alamo Breast Cancer Foundation. Les quiero hablar de parte de hacerse sus anales, pruebas anal por año con su doctor o una enfermera práctica. Es importante detectar si hay el azúcar más alta, el colesterol alto, o si la presión se ha hecho más alta, porque pueden hacer algo, le pueden platicar el doctor o le puede avisar su doctor que debe de cambiar cómo come, dejar la sal, todo eso, o si necesita medicina para la presión. También cuando va con su doctor o un médico profesional, también le hacen el examen de los senos, el examen clinical de los senos. Si no hay bolitas o algo sospechoso, la van a mandar para que se haga una mamografía del año, que son nomás 2 videos, 2 retratos. Pero si notan algo sospechoso en su seno, la van a mandar y van a ordenar una mamografía diagnóstica o una sonograma. La sonograma determina si la bola o algo sospechosa es quiste, que es una bolsita que tiene líquido, eso no es sospechosa, o si es algo sólido. Y nomás si se encuentra algo sólido, eso no quiere decir que es cáncer, porque hay fibroadenomas que son tumores benignos y no son cancerosos. Pero es importante hacerse esos anales. Hay unas cosas que un doctor o una enfermera práctica no puede detectar con las manos. Nomás el sonograma o la mamografía va a detectar especialmente microcalcificaciones, que son depósitos de calcio en los senos. Y si están desparramados, no es problema. pero cuando se comienzan a juntar es posible que está empezando un cáncer y es cuando se debe de encontrar porque es más temprano y no tiene que hacerse la quimioterapia, la radiación, todo eso. Es mejor detectar, si detecta algo sospechoso, vaya con su doctor y le dice lo que usted siente. Debe de conocer su seno, si hay algo nuevo o si hay cambios. Reporte eso con su doctor y se hace su mamografía cada año. Es mejor, porque si se encuentra temprano, puede ser algo temprano y los resultados son más mejores. No hay mucho tratamiento si se encuentra temprano. Gracias.
My name is Catherine Brown, and I am the Precinct 4 Bexar County Constable. So my cancer journey period began when I was at the age of 24 years of age. My husband at the time was stationed at Travis Air Force Base, which is also my home state of California. And I was a young mother of one. He was 7 years of age. And I went in for a pap smear, and my oncologist found a tumor the size of probably a pinhead, okay? And he told me to come back, follow up with my exam, and me being the young woman that I was, thinking that, oh, there's nothing wrong with me, he's just, probably a young doctor, may have stumbled across something that didn't look familiar, but it didn't apply to me. So a year later, that pinhead size mass grew to the size of a grapefruit. And at that time, I was informed that I had stage 1 ovarian cancer. I went for my chemotherapy treatments, I had surgery, and I survived it. Since then, we moved to Texas. My husband then got stationed at Lackland Air Force Base. And 10 years later, I was at that time a young officer serving at the Bexar County Sheriff's Office. And I was also a part of the emergency response team, which is like SWAT in the jail. And that morning I had to do some type of training with my fellow officers. And at that time, me and a female officer were sparring, went down to the mat, and I had some chest pain. So that evening, that chest pain persisted. And I was doing a self-examination and found a tumor on my left breast. So 10 years later, I got breast cancer. And I went through the chemotherapy treatments, I went through radiation, and also a double mastectomy. And at that time, I realized that just because you had cancer once does not mean that it won't repay you a visit. But praise God, I survived both cancers, and I've been able to also just mentor different women that are also going through cancer. And I've also been promoting the BRCA analysis test, which is a genetic testing, because studies have recently shown that breast cancer is related to ovarian cancer. So for those of you out there that have had breast cancer, please take the BRCA test so that you can determine whether or not if it's a genetic link to your tumor, and hopefully you can get some type of premeditative testing done. And I will say this, I am so grateful for Black Nurses Rock and the Alamo Breast Cancer Organization, because if it had not been for these beautiful establishments, I would not have had the resources that I have and the resources that they provide to so many people. So make sure you do your pap smears and make sure you do your self-breast examinations, and that is definitely the key to surviving both cancers.
I'm Gilbert Martinez. I'm with the University Health, and I'm the Assistant Director for CareLink. CareLink is a financial assistance program for Bexar County residents or those that live in San Antonio. We are not an insurance, but a financial assistance program. CareLink es un plan de pago, no es aseguranza. Es un plan de pago para los residentes de San Antonio o del condado de Bexar que no califican para servicios médicos públicos o privados. Our Bexar County residents that live in San Antonio and can prove that they live here. In order to qualify, there's 3 proof documents that you need to have. You need to have a valid ID. The ID needs to show your name, address, have your photo on it as well, and it has to be valid. Also, proof of income, how you support yourself. If you work, you get paid by check, we need the check stubs for the last 30 days. Your income tax, if you're self-employed. If you receive Social Security benefits, we need the current letter for the year. Also, if for some reason you get paid by cash, we do have forms that we can give to you in case you need those forms also. You need to have proof of residency, like a light bill or water bill, something showing your name and address that you live here in Bexar County and showing that you have active services in Bexar County. Las personas que califican para nuestro programa de CareLink son residentes que viven en San Antonio o en el condado y necesitan que tener 3 documentos para calificar. Tiene identificación, algo que enseñe su foto, su dirección, su fecha de nacimiento. También necesita que enseñar que la persona aplicando vive en San Antonio. Necesita que tener un estado de luz o agua, ahora enseñando su nombre y la dirección aquí en San Antonio. También los ingresos, cómo se está soportando. Si trabaja, necesitamos los talones de cheque, los reembolsos de impuestos, si trabaja por su cuenta, o si recibe seguro social, necesitamos la carta del corriente año. O si necesita formas que le pagan en efectivo, CareLink le puede dar esas formas, pues también están en el correo electrónico del website de University Health System CareLink. CareLink provides your medical services within the University Health System. CareLink is only within the University Health System, where you receive medical services. You also receive specialists if you need to see a specialist. You get prescription coverage through the university pharmacies. You get express med services, emergency room. Any type of medical services that are covered through the CareLink program are covered under your CareLink program. Los servicios médicos que puede calificar si está elegible para nuestro programa de CareLink son servicios médicos. Puede tener su doctor privado que va a estar asignado, que puede ver para sus servicios médicos de su salud. Puede recibir servicios del Express Med, de la sala de emergencia, especialistas y también las farmacias de University Health System para llenar las medicinas que necesita para su salud.
My name is Tanya Burris and I'm the Director of Grant Services with University Health System in San Antonio. Healthy Texas Women is a program dedicated to providing women's health services and family planning at no cost to women in Texas. These services they provide help women plan their families, whether they're trying to become pregnant, delay pregnancy, or avoid becoming pregnant altogether. These services really do help women with general health now and in the future. The Healthy Texas Women program is designed for women who are 18 to 44 years old. There are provisions to allow women as young as 15 to 17 to enroll in the program. They do have to have parental consent. The parent or legal guardian has to enroll and renew into the program. You have to be a U.S. citizen or a legal immigrant, a resident of Texas. You cannot be pregnant, you cannot have insurance, and you have to be at or below 200% of the federal poverty level. Healthy Texas Women provides a wide variety of services at family planning clinics across the city that include pregnancy testing, well woman exams with pap smears, STD testing and treatment, screening for HIV, clinical breast exams, mammograms, a wide variety of birth control options like condoms, birth control pills, Depo-Provera injections, long-acting reversible contraception like LARCs, IUDs, and Nexplanons, and it goes all the way. It even provides for having your tubes tied. Another added benefit of this program is it provides services for postpartum depression screening and treatment for women who have delivered.
My name is Joellen Fraga. I work for University Health System. I'm a patient navigator with the Grant Services. Breast and Cervical Cancer Services, which is BCCS for short, it's a grant program whose goal is to help women receive quality and accessible preventative healthcare screenings at no cost. Regular screenings may find pre-cancer or cancerous condition when treatment is likely to work best. BCCS provides screening mammograms for women ages 50 to 64. It also covers breast diagnostic services for women between the ages of 18 to 64. Breast diagnostic services include breast ultrasounds and breast biopsies. Cervical diagnostic services for women between 18 and 64. Cervical diagnostic services consist of cervical biopsies, diagnostic procedures, which are tests that are performed used to rule out or confirm cancer. Women that are eligible to receive breast and cervical cancer services are women who are a Texas resident, a woman between the ages of 18 to 64, and have an income below or at the 200% federal poverty level, do not have health insurance, or are underinsured. MBCC is Medicaid for breast and cervical cancer. It's a Medicaid program that provides access to cancer treatment for qualified women diagnosed with breast and cervical cancer or certain precancerous conditions. Women are eligible to be enrolled into the Medicaid for breast and cervical cancer if they are uninsured, between the ages of 18 and 64, a U.S. citizen or qualified legal immigrant, a Texas resident, and their income level has to be at or below the 200% federal poverty level. MBCC, Medicaid for breast and cervical cancer, provides full Medicaid benefits as long as women are eligible. Women must renew their Medicaid application every 6 months. The MBCC program provides patient navigation, care coordination, and facilitates cancer treatment services at no cost.
Hello friends, Senator Jose Menendez here, and I am honored to be included once again at the Alamo Breast Cancer Foundation's annual outreach program, Healthy Women Make Healthy Communities. I'd like to take this opportunity to thank your Government Relations and Advocacy Chair and my good friend Dale Eastman for inviting me to be a part of this annual event, and to all of you advocating for cancer awareness for women. Driven by your commitment to women's health and safety, you have been an inspiration to thousands through your tireless work with policymakers, community partners, and health professionals. I don't have to tell you how challenging this year has been for all of us across the state of Texas, having to make difficult adjustments and decisions because of COVID-19. And as we continue to navigate our way through these challenging times, we also have an opportunity to address the priorities of the very diverse communities across this state. One of the issues that will be at the forefront, and I will continue to advocate for, is women's health and women's right to have choices when it comes to screenings and the decisions about their own bodies. This fundamental standard is the foundation of the Alamo Breast Cancer Foundation, and it is one of the many reasons why I am so proud to support this organization. The Alamo Breast Cancer Foundation's main goal has been to end breast cancer by assisting those who have been diagnosed while working with health professionals and policymakers to spread awareness. 30 breast cancer screenings were donated this year by the Alamo Breast Cancer Foundation, which means that 30 women will have an opportunity to have a screening that they may not have been able to afford. Making sure women have access to these important screenings, regardless of their financial status, is a key when it comes to the ultimate goal of saving lives. However, the fight is not over, and we must continue to advocate for the many unresolved issues pertaining to all aspects of medical care, screenings, and programs that impact the lives of Texans. In the midst of this global pandemic, it has been proven that access to medical care is more essential than ever, and we must expand Medicaid for everyone. Healthcare is a human right, and we must ensure that everyone who needs it, who is ill, they get the treatment without having to worry about the possibility of going bankruptcy. This is why I've introduced legislation to help create better access to women's health services, education, and healthcare opportunities. In the 86th and 87th legislative sessions, we filed bills that would require a health insurance plan to provide coverage for fertility preservation services to patients who will receive cancer treatment and could possibly cause infertility. As legislators representing our community, we must provide useful information on what's happening in the legislature and how the community can participate in advocating. People can improve our community by being sources of information and encouraging others to get involved in every aspect of their lives, including getting out to vote. Friends, there's an old saying, elections have consequences, and your vote can make the difference at every level of government. Thank you, Alamo Breast Cancer Foundation. You are saving lives with this life-saving information. Let's remember to work together, raise your voices, and keep rallying for change. And on behalf of the Alamo Breast Cancer Foundation and all of its supporting partners, for the common goal, a world free of breast cancer.
Congressman Castro, at 28 years old, was elected to the Texas legislature as state representative for District 125 and served 5 years. In 2012, he was elected to the U.S. House of Representatives, representing the 20th Congressional District, which covers a huge portion of San Antonio and Bexar County. He currently serves as chair of the Texas Democratic Caucus. The Alamo Breast Cancer Foundation Board of Directors and Alamo Breast Cancer Foundation Action Network thank Congressman Castro for his leadership in ending breast cancer by co-sponsoring H.R. 2178, the Metastatic Breast Cancer Access to Care Act, as well as signing the Dear Colleague letter supporting the $150 million appropriation to the Department of Defense Breast Cancer Research Program.
Hello, y'all. I'm Joaquin Castro, and I proudly represent San Antonio in the U.S. House of Representatives. I want to thank Dale Eastman and the Alamo Breast Cancer Foundation for including me in this year's program. Despite considerable progress in prevention, more accurate diagnosis, and better treatments, about 12% of women will develop breast cancer in their lifetimes. And unfortunately, breast cancer remains the second most common cancer among American women. Cancer affects all of us, either directly or through a loved one. So, we must continue to invest in breast cancer research. That's why I support President Biden's work to forge new partnerships and create new initiatives towards ending cancer as we know it. It's also why I joined a bipartisan group of members of Congress in requesting $150 million in next year's budget to accelerate high-impact cancer research programs. Furthermore, I'm a proud co-sponsor of H.R. 3183, which would guarantee folks suffering from breast cancer the ability to access and afford the medical care they need. These efforts will greatly contribute to our understanding and treatment of breast cancer. There's still, as I mentioned, a lot of work to do, but together we'll find a cure. Again, thank you to the Alamo Breast Cancer Foundation for stepping up and leading in our community. And thanks for having me, and I look forward to seeing y'all soon.